I'm Dr. Prenelle, and I'm a consultant general adult psychiatrist, and I treat people with a full range of conditions such as bipolar disorder, anxiety, depression, and psychosis. I carry out assessments for ADHD with a diverse range of patients from age 18 to over 70. In doing so, I meet people from all walks of life and occupational roles. ADHD is a condition which is lifelong. It has to have been present in early childhood for a diagnosis to be made in adulthood. So a common theme amongst patients I see is that they have had experiences of difficulties earlier in life that weren't picked up, or if they were attributed to some other cause. Nowadays, there is much higher awareness of ADHD in the media and among medical professionals. So more people are beginning to think about ADHD and to question whether it may have been the cause of difficulties they've had in education, at work, or in their relationships. So more people are beginning to think about ADHD and to question whether it may be the cause of difficulties they've had in education, at work, or in their relationships. Now, it's been in the news a lot recently that there are concerns that there may be overdiagnosis of mental health conditions, including ADHD. However, it's important to take a careful, thoughtful, nuanced view of this. This is a debate that can become polarized in an unhelpful way, in a way that loses sight of the real difficulties that people with ADHD struggle with. As well as the concern about overdiagnosis, there is an equivalent opposing concern that ADHD is underdiagnosed in the adult population. There is quite strong evidence that this is the case. The change represents more awareness of ADHD, but also changing diagnostic criteria. What we do know is that there is a significant backlog of people who have struggled with ADHD for their whole lives and are only now coming forward to ask for assessment and help. NHS services have not been able to keep up with the increase in people seeking assessment, so there has been a growth of demand within the private medical sector. We can hope that this will change and that in the future there will be better provision for ADHD within the NHS. But currently, the waiting list for NHS ADHD assessments is stretching to 3 or 4 years. In these circumstances, it's very important that people still have the opportunity to access a full specialist assessment for ADHD. The concerns about overdiagnosis are probably more accurately described as concerns about misdiagnosis, of people experiencing some of the symptoms of ADHD which are actually caused by some other condition. There is considerable overlap between some of the symptoms of ADHD and anxiety, depression, and some personality disorders. The concern is that with the media and cultural spotlight being turned on ADHD, people will be diagnosed with ADHD when they actually suffer from one of these other conditions. The negative consequences of this are that people may not receive the treatment that they need for one of these other conditions, and are offered treatment for ADHD which they don't need and which may cause them to experience side effects. On the other hand, there is a longer-term risk of underdiagnosis of ADHD. Looking back 10, 20 or 30 years, when our current adult patients were at school, there was very little consideration of ADHD as a possible cause for specific learning problems. So many people have had to struggle on with potentially debilitating deficits in attention and concentration, as well as symptoms of restlessness or impulsivity, which can lead to other problems in life. So accurately diagnosing someone with ADHD in adulthood is extremely important, both to avoid missing a potentially treatable condition, but also to avoid starting someone on a treatment that they don't need. It's for these reasons that adult ADHD assessments have to be conducted in a very careful and detailed way. The assessment must include a full exploration of someone's developmental history from early childhood onwards. It must also include the full assessment of their mental health to look for or exclude other conditions that could be the potential cause of their difficulties. Finally, the assessment should include collateral or objective information in the form of school reports or childhood assessments, and information from the patient's family or parents that can elaborate the developmental history, and the sorts of difficulties that they may have had in childhood caused by ADHD. Assessments need to be carried out by a consultant psychiatrist trained and experienced in assessing and treating ADHD and able to exclude other conditions. This way, there is a lower chance of misdiagnosis, overdiagnosis, or underdiagnosis, and we can build an assessment based on a range of evidence. Even in cases where, following assessment, the diagnosis turns out not to be ADHD, it can still be a very helpful experience to explore alternative explanations and to help people find the kind of therapy, support, or treatment that can help them to recover and move forward in their lives. Many people wish to explore the diagnosis of ADHD simply to understand themselves better and to make sense of the difficulties they may have had with organization, time management, forgetfulness, task completion, or impulsive life choices, fluctuating emotions, etc. For other people, assessment is just the beginning of a journey to make changes in their lives through treatment or therapy. ADHD is a very treatable condition, and we can help people access psychological therapy, ADHD coaching, cognitive behavioral therapy, or medications that can help people to develop strategies and to reduce their symptoms.